And joining me now to talk more about this is John Cerasani with Northwest Comprehensive. And your company is basically an insurance consulting company. So explain what that is, first of all.
Sure. Employers will hire us to help them navigate through their ever-changing health insurance issues. So health insurance, life insurance, disability insurance, really anything relating to their employee benefit programs. With legislation changing and just so many different avenues you could go down nowadays, they hire firms like us to help them through that process.
So this is really good for your business. Any sort of change in the way things work, they're like, help!
Yeah, there's definitely a lot more inquiries since healthcare reform came along, and actions like today with us anticipating what's going to happen next, just more and more phone calls, more and more emails, and just more work from our existing clients, for sure.
With the way healthcare reform is as it is now, let's forget about the repeal for 1 second.
Sure.
What exactly have you been able to help people with? I mean, what kind of things are people asking, and what kind of needs do they have? Different companies.
Well, we work only with employers, so they're buying insurance for their employees. And one of the issues really the problem so many people have with the bill as it is today, the acronym for it is the Patient Protection and Affordability of Care Act. Okay. Well, there was really two issues. There was access to insurance, and then there was affordability of insurance. Those were the two issues President Obama talked about while he was campaigning. Those were the two issues that were supposed to be addressed within healthcare reform. Problem is, only one was addressed. Access for the uninsured Americans, that was addressed, but nothing about affordability of care.
Okay.
In fact, the opposite has happened. Employers are now put in a position where the government's mandating you have to do this, this, and this, or otherwise, you know what, they're already able to do that. They're already able to buy insurance plans with unlimited lifetime maximum benefits. They're already able to do that a year ago.
They just weren't doing it, but now they're required to.
Right, and you pay more for that.
Okay.
So if I'm an employer and I'm insuring my 300 employees and it's costing me $2 million a year, I might tell my employees I'm buying you something that has a $1 million or $2 million lifetime limit, okay, versus paying $100,000 more or whatever for an unlimited limit. Well, now I don't have that option with health care reform. They're telling me I have to do this.
So it comes off the company's bottom line. So companies are all for this repeal.
Well, not necessarily. At the end of the day, it's really better for the patient, okay? So you got the patient protection, okay? That part is there. No one's going to argue that
pre-existing conditions, etc.
No one's going to argue that getting kicked out of the hospital because your insurance ran out is a good thing. Nobody likes that, okay? But the fact of the matter is, on the back end, there needs to be something within this bill, and this is why so many people have a problem with it. There's nothing to control the costs, okay? So we're protecting the patients. On the back end of that, nothing to control the costs. The insurance companies are taking that premium and using really 85% of it to pay the hospitals, doctors, other providers. Well, there's nothing in this bill that's mandating that the hospitals can't continue to up their charges year after year. And that's what's been going on the last 10 years.
Okay.
So now in addition to that, we have employers in a position where, okay, not only are you telling me I have to do this, which I agree is great for the patients, okay, great for my employees, but something's got to give at some point. I can't afford this anymore.
Gotcha. So maybe that's part of the discussion down the road, because honestly, this looks like posturing. It's not going to get through the Senate. It's sort of symbolic. But at least it raises the discussion again, and maybe businesses can get in on that end and explain the problems that are existing.
Well, yes, and I think everybody in Congress and all the legislation are in agreement that this thing isn't perfect. They've said that. And employers are just faced with difficult decisions right now.
All right, John. Thanks so much to kind of help
Thanks a lot.
clear it out for us. Appreciate it.